Well, welcome everyone to the University of Denver webinar on fall 2021. I want to thank you for joining us today. I'm Jeremy Haefner, Chancellor at the University of Denver, and it's my honor to be with you today along with a number of wonderful colleagues to help answer any of your questions regarding the fall term, which we are incredibly excited to share with you. We know that students and families, while they're excited to come back to the campus of the University of Denver, there are also many questions that I'm sure are on your mind, especially as we continue to offer safe in-person learning during an incredibly dynamic pandemic. So we're going to get to many of your questions in a panel style format. And also enable you to ask any questions that you want in the Q&A. I'd like to start off, however, by introducing our panel of leaders from across the campus whose units and departments are really essential to our COVID-19 mitigation policies and procedures. There's Mary Clark, our Provost and Executive Vice Chancellor.
Hello.
Todd Adams, Vice Chancellor for Student Affairs. Shana Alston, Executive Director of Housing and Residential Education. Jay Finnegan, Pulmonologist and Director of the National Jewish Health's Respiratory Centers of Excellence. Mike Holt, Interim Director of Campus Safety. Jennifer Karis, Vice Provost of Academic Affairs. Michael LaFar, Executive Director of the Health and Counseling Center. And Sarah Guatemara, our COVID-19 response coordinator. They'll be with us the entire hour, answering your questions, and of course, saying a few statements early on. In addition to, however, to the folks on the screen, we also have a team behind the scenes helping to answer your writing questions in the Zoom's Q&A feature. We encourage you to go ahead and submit your questions, and we'll get to as many questions as possible and answers, of course, as available with the time that we have. And also, I want to point your attention that if you would like closed captioning, be sure to enable Zoom's automatic closed captioning feature that's found at the bottom of your screen. Now, our panelists are soon going to get into the details regarding our COVID-19 mitigation efforts, but I did want to take this moment to highlight how incredibly successful the University of Denver has been in mitigating the COVID pandemic to date. And our successes and lessons learned have really prepared us to confidently offer a fully in-person experience for our students in the coming academic year. So, for example, across the entire DU community, students, faculty, and staff, we boast incredibly high vaccination rates. Of those who are cleared for campus, 93.4% are vaccinated. I think this is important to put in context with the rest of the state of Colorado, where 56% of the Coloradans are generally fully vaccinated. So that in itself indicates that we have a very safe environment to welcome your student back. Vaccinations, of course, is just one tool in our toolbox that we use to mitigate the COVID pandemic. We also will use a very robust testing procedure. We have our own test lab, and we use a spit version of the PCR test. It's very quick and easy to do, and we'll be using testing. We'll also be using contact tracing as a way to make sure that we understand if there are any positive cases, where they're coming from, and how we can quickly mitigate and contain those cases, because the health and safety of our students, faculty, and staff are paramount to us, as you can imagine. We constantly monitor on-campus and local conditions, and we're really agile at pivoting at the exact moment. But we are fully expecting to be fully in person. We're so excited to welcome back the students who will not only have a really incredible academic experience, but also a really meaningful social experience that we've been known to provide. For you incoming students, we recognize that learning about the community's response to COVID-19 can be a complex task. And I just wanted to provide some overview of how you might get additional information. So first of all, we have an amazing COVID-19 response team, and this is headed by Sarah Guatemara, who I introduced just a few minutes ago, and who will be available to answer your questions and offer guidance. But the university is also blessed to be working very closely with local experts in our dedicated health partner, the National Jewish Health Organization. And Jay Finnegan here is from National Jewish Health to answer any of your questions of how they engage with us. But we established this relationship back in July of 2020, and they've been incredibly helpful in guiding us, helping us provide testing, and really being a part of the decision-making process. By the way, National Jewish Health is a not-for-profit academic health center, and it's the #1 ranked respiratory hospital in the United States. So we all feel very confident that we have the right expertise helping us. Our coronavirus focused website is a great source for finding out the latest information, frequently asked questions, and of course our dashboard, which contains information about testing, our vaccination rate, our positivity rate, our isolation and quarantine space capacity. Our website is du.edu/coronavirus. So go there and you'll find all the information that we have available for students and parents on a daily basis. The website also displays which alert level the university is currently operating at, and we're currently at the green level. And you can see the other levels and what description of them on our website. Finally, we do pride ourselves in a very robust, regular communications. These come from either myself or from Sarah Guatemara regarding the COVID-19 pandemic and our response to that. We also post these communications to new parents and families on our Facebook page. So again, great enthusiasm. You're going to learn what the experiences will be like in this coming fall. You're going to learn both in the classroom, outside the classroom, in the residence halls. And so let's get to it. I thank everyone for joining us today. I'm incredibly excited for the fall and the vibrancy that we'll have. So now I'm going to turn it over to our Provost and Executive Vice Chancellor, Mary Clark, who will talk about COVID-19 and the academic experience coming this fall. Mary?
Thank you, Chancellor. And for those of you at home wondering what is a provost, I am the Chief Academic Officer at the university, so I work very closely with all faculty and students in terms of their academic experience here at DU. And just share a couple things with you and then very much welcome your questions. The Chancellor highlighted that our undergraduate experience will be significantly in person, and it will. More than 95% of our coursework at the undergrad level will be offered in person. At the graduate level, it's more varied in recognition of the needs of our graduate students. Our graduate students are often also pursuing jobs or have family care responsibilities or otherwise. And so the Chancellor and I had charged the deans of the graduate schools to work with their faculty and their communities to determine the optimal mode of that instruction. And I'm pleased to say that 63% of graduate instruction will be presented in person. And we will also have robust online instruction for those for whom it makes most sense at the graduate level. Again, I'd welcome your questions and comments, but right now I'm going to turn the stage to our Vice Provost for Academic Affairs, Dr. Jennifer Karis, who is also faculty in our sociology department within the College of Arts, Humanities, and Social Sciences. Hello, Jennifer.
Hi there. Thank you so much, Provost Clark. And if anyone is confused about what a provost is, my understanding is that a vice provost is even much more distant to understand. But please know that I am the steward of the curriculum. I need to make sure that we have the right kinds of classes, the right mix of major and minor and general education classes, that we deliver our curriculum with integrity with respect to the university mission. So I think it's a great job. And I want to thank all of you for what you did and showing up for with your best selves in your classes last year. Right, we've all had a really difficult last 18 months, and I know that we're looking so much forward to our experience in the fall. And knowing that it's going to be that each day that we're together, we get to rebuild our community and remake our experience here at DU. So I'm thrilled to be able to welcome everybody back to their fall quarter, whether you'll be living in the residence halls or living in our community nearby. With that, I think I'm going to introduce it to our Vice Chancellor for Student Affairs, who can put the wraparound on the student experience outside the classroom. So Todd Adams.
Thank you, Jennifer, and welcome everybody. We are so excited about the year ahead, and all of the gratitude that Jennifer offered, I want to echo for really standing up and helping us get through the year. We learned an awful lot, and through that, we know that we can do this thing called in person, and we're excited to be able to offer it in the way that we are this fall. We are substantially going to be in person, as the provost said, for our undergraduate curriculum and really the co-curriculum, those things that happen around classes that add flavor to students' lives and to their education. We have a number of events already scheduled, kicking off with Discoveries, which is orientation for our first year students. There have been some questions about what we might do for sophomores. We will be having in-person activities for sophomores even after they move in on Wednesday, September 8th, and going through the week, especially for them, including games, movie night. We're going to be going to a Rockies game later in the month after classes open. So our sophomore class will have a distinct experience that perhaps was missing when we were primarily remote, even with students on campus last fall. We're very excited to do a number of things in our new community commons, the building that opened mid-year this past year, as well as the Burwell Center for Career Achievement. Number of events and activities will be in person following our COVID protocols, which I know Sarah Watamura will discuss in just a minute. But in our estimation, we're going to be able to offer almost all of the kinds of activities and programs students have desired. Our clubs and organizations, 100 of which are going to be in an activities fair in the first week here, and a carnival that our fraternities and sororities will be putting on in the first couple of weeks. So we're excited to be able to be back, to have students gathering safely, but also in person, and using the facilities that we have, which includes a residential experience that almost 2,800 of our students will enjoy. With that, I want to make sure that we talk a little bit about that residential experience. And to that end, I'm going to invite my colleague and friend, Shana Alston, who is Executive Director of Housing and Residential Education, to talk about what we're doing there and the RAs that have just arrived as of yesterday.
Thank you, Todd. Good afternoon, everyone. I am Shana Alston. I serve as the Executive Director of Housing and Residential Education, and we are excited to welcome over 2,800 residential students to join us on campus starting Labor Day. So on Monday, September 6th, we will be welcoming back our first year and transfer students. And as Todd mentioned, our second year students will be returning with us on Wednesday, September 8th, to participate in a variety of amazing discovery events. And we're excited to bring them back into the halls early so we can recreate the experience that they may not have been able to have last year. Our upper class students will be welcoming back to campus on Saturday, September 11th. So we've sent multiple communications to your students detailing the move-in process and our testing requirements. And so that we ask that all students select move-in appointments by September 1st, so you can help us manage the traffic that we have on campus as we're inviting back both students, and they're allowed to bring 2 guests to help them as they move into the residence halls. I just want to mention we have a phenomenal staff team of master's level resident directors, graduate resident directors, and peer support offered by our student staff comprised of resident and community assistants who live amongst the students in housing. Our team will get to know your students to best support them as they live safely in the residence halls, to connect them with their fellow students, the DU campus community, and the local Denver community. And so we're excited to create that experience for your student and to welcome them back in the coming weeks. I would like to introduce now my colleague, Sarah Guatemara, to speak a little bit more about COVID.
Thank you, Shayna, and lovely to be with you all again. I'm going to go over, I've been answering questions in the chat, and there are a couple of live questions that I think lots of people would probably like to hear the answer to. But before we do that, I'm going to just quickly share my screen and go over our overall approach here. So if you think about how we manage COVID, we have been doing a number of different things across all of last year and then again this year. And a lot of the strategies that we used last year, we're going to continue to use this year. So if you look on the left, there are the institutional supports that we've put in place. We have invested in an incredible partnership with National Jewish Health and built a testing lab on campus that allows us to provide a flexible tool to understand what the conditions are on our campus and use that to drive what alert level we're in. So you will see, and there's questions in the chat about why am I doing more frequent testing if I'm vaccinated? Testing is the way we know what it is we're working with. We're able to provide those results the same day, and we're able to adjust them flexibly to what's happening on campus. With the Delta variant, we have seen, of course, more breakthrough cases, and this gives us a lot of confidence in what it is we're working with. So testing is one of our big tools, and we use that. And you can look individually to see what your testing schedule is, and please keep attentive to what the testing requirement is. You know, the best thing is if we test a lot and find out that we have very few cases on campus, and we can all feel really confident in all of the ways that we're engaging together. The second tool that we used last year and we'll use this year is we very quickly trace, isolate, and quarantine. So within an hour of the test result, our contact tracing team is on the case, doing interviews with folks, finding out where they've been. We look at student class records, we look at badge access, and then we go ahead and quickly isolate people who are positive and where necessary, quarantine their close contacts. The current public health requirement is that you are quarantined only if you are not vaccinated. But if you're fully vaccinated, we still require that you test according to the schedule we give you and that you monitor your symptoms closely. So that way we really quickly put a bubble around any positive cases and get that under control really quickly. So that's another really important tool. Another way the institution has invested in managing COVID is by intensive ventilation upgrades in all of our buildings. We put a lot of effort into that last year and are continuing that this year. And then we have our custodial colleagues cleaning and disinfecting on a frequent schedule and using tools that we didn't own before COVID. So those are all still happening. Then we still need everybody to do the things that we all do to keep each other safe. Stay home if you have symptoms. Watch yourself carefully for symptoms and stay home if you're sick. Wash your hands, avoid touching your face. And then if you think about what we did in 2020, 2021, we did a lot of social distancing and masking. We had our de-densified housing, we had de-densified classrooms, and that was hard on all of us. It was hard to not be able to do so many of our important activities together in person with all the people that we care about and learn from and want to be around. And so this year we have had, because of the incredible advancements in science, we have these really effective vaccines. And we now have that tool to replace, in a sense, this need to be socially distant and not together as much, right? So we have a vaccine mandate that we put in place. We were in the first 20 schools to put that in place. We've had a lot of support. We've vaccinated, we've done 31,000 doses of vaccine on campus. So that allows us to be more confident in being together in our classes, but also in our clubs and social activities and living together at full density. And then we will use masking as needed. So you can follow along in the alert level to see how masks are necessary. And that also helps us work with what's happening in Denver. So this is the set of strategies we use. We apply them in different degrees, and you can see exactly how that plays out by looking at the alert levels. And another question from the chat is, what's our plan for an outbreak? We know very quickly if we have an issue on campus, and we can put a bubble around it quickly. And then we can adjust our alert level if we need to, or take a more targeted approach, which would be, for example, having an entire building of people under a different set of restrictions for a period of time if we needed to do that. So I hope that gives you a sense of what our big picture plan is. We use all of these tools flexibly. Vaccination has really allowed us to be back together, fully densified, and that's where we focused our attention this year.
Thank you, Sarah. Well, now let's turn to some of the many wonderful questions that are coming in the Q&A. Thank you all for going ahead and providing those. Mary, I'm going to start with you. By the way, before I dive into a question for Mary, I just want to say testing is going to be really important. I am vaccinated, been vaccinated for many, many months now, but I am making it a habit to test every week. Why am I doing that? Because I believe that testing is one of our most powerful tools to maintain fully robust, interactive, immersive, stimulating intellectual environment on here. And I will commit to doing that throughout the rest of the term here, because I really believe that testing and of course following the rest of our protocols is really critical. So it takes 2 minutes and is very non-intrusive. It's really an effective tool for us. But to the questions, Mary, one of the questions that have come in says, will there be an online option? I personally think it would be more accommodating since some students might not be comfortable having to take in-person classes. Could you help address that question for us?
Sure. So we will be offering our courses in the modality in which they are currently posted. So there are a range of ways in which in-person courses are offered, whether in lecture, or lab, or fieldwork, or otherwise. And if it's posted as online, then it will be in the online modality. If students are not able to attend a particular day's class meeting because of illness, then the student and his or her faculty member will work to make sure that the student has access to the materials covered that day. All of our faculty are to develop shells on our learning management system, otherwise known as Canvas, and materials are posted to that shell so that all students can follow along. I'm experiencing this firsthand as I will be teaching in the fall and have been working to develop my Canvas materials. But as a short answer to the student's question, courses will be taught in the modality for which they are currently posted.
And I can say that the faculty are very excited to be back in person. I have chatted with them forward to that. Todd Adams, I know that you addressed a number of plans for second year student sophomores, but could you look the audience members know a little bit more about orientation week itself and what they might come to expect as kind of that welcome back again to the University of Denver sort of feel?
Sure. Thank you, Chancellor. We are very excited, just as faculty are, to be back, to have our staff back in person and ready to be working with and together with students and our colleagues. Discoveries, which is our orientation week, will begin really on Labor Day with move-in, but that next day, we will begin a number of activities, most of which will be done in some smaller groups, in peer-led groups with orientation leaders, but we'll have also some larger scale events that we do. Some of them are like convocation, some of them are activities fairs where everyone will have a chance to meet other students, particularly our upper division students who may be leading student clubs and organizations. Later in the week, we will be going with our first year students out on trips into the community with their first year seminars. And so we'll have a number of activities that way. So between social events, academic related events, opportunities to engage with their peers, and a number of social activities on and just near campus, we will have the full complement of events that last year we either had to do virtually or we had to forego. So this will be much more of a traditional new student welcome and orientation for academics, for social, and in the residential spaces, following all of the guidelines that Sarah Guatemara has offered. There was a question also in the chat that somebody had asked, and I really appreciate it. We have transfers, and we had students transfer in last year, and they may have lived on campus, they may not have, but how are we reaching to them, given that their first year with us at DU may have been a little different? We will be inviting them to any number of these events, and particularly those for our sophomore and upper division students that are really located for them socially. That might be a little different than some of the traditional first year student activities and programs. So those students will be invited, and our programming board, along with our Office of Student Engagement, I just reviewed today their materials that they'll be throttling to all of the students here in just the next couple of days in preparation for the next couple of weeks. So we're very excited to welcome everybody back.
Right. Thank you, Todd.
Bet.
So the next question is perhaps a question both for Sarah Guatemara and Shana as well. It's a really interesting question. As everyone probably read in the media, the FDA officially approved formally the Pfizer vaccine, and we expect to see other approvals of the other vaccinations coming forth over the next several weeks. So one of the questions, of course, we're interested in is helping if unvaccinated students want to become vaccinated. And so the question is, what happens if an unvaccinated student gets vaccinated? Will that person or their roommate get a new roommate? Because after all, we're trying to pair up roommates that are both unvaccinated and vaccinated. So Shana, do you want to take that one, and Sarah fall in too?
I will defer to Sarah, but I think it depends on timing. And so if students have been vaccinated and they upload their records by September 1st, then, and it matches with their roommate, they can stay living together. However, as of the 1st, once we have in all those vaccination records, on the 2nd, we will start to look at if students are in rooms with roommates who have like vaccination records. And at that time, we would make a room change. If they find that after the first day become vaccinated, we will open up a room change period starting October 1st, and that will be dependent on what's available in housing. Sarah, is there anything you would want to add to that?
No, that's exactly right. So we have been grouping people together based on whether they're fully vaccinated or in communication with us and on the progress to be fully vaccinated. Folks who have exemptions, right? And then there is a category of students who we haven't yet heard from. So those are also grouped together right now. We are quite past the deadline. So changing your status quite past the deadline does make it tough on us, but we are tracking those carefully. If you are one of those students, you should have received phone calls and text messages at this point as we try to get you correctly assessed.
Great. Thank you, Sarah. Just expanding on the exemption, one of the questions is, what are the exceptions for people to be not vaccinated? I think people would be interested in hearing that.
Sure, I'm happy to take that. So, this has been a moving landscape, and we were one of the very first schools to put an exemption process in place. And at that time, we put in medical and religious exemptions. And then we also have a category where we had a number of people who were concerned about no vaccines having full FDA approval. And so we also had a category for that. Of course, as of Monday, that category is no longer valid. And then we have a small number of other types of sort of more complicated situations that people are in. We have a small number of exemptions. And I will say that a chunk of that small number, so it's just a little over 400, a good 150, 175 of those were about the FDA authorization. So I do expect that we are going to have quite a small number of exemptions. Then in the process, The city of Denver now requires that everyone who works in any capacity, so that's an employee of the university, a contracted employee of the university, or a regular volunteer of the university, has to be vaccinated or have a medical or religious exemption. So those other types of exemptions are no longer allowed, even for student employees. So that change we are working through. We're working with folks who have other types of exemptions.
Thank you, Sarah. This is really for Michael here. It's a question I think that it still has people a little confused on the quarantine protocols for vaccinated and unvaccinated students. So, and Sarah, please feel free to chime in as well. But the question is, if a fully vaccinated individual tests positive with no symptoms, do they follow the same quarantine protocols of an unvaccinated positive individual also with no symptoms?
If I can jump in, and Sarah, invite you to as well. Yeah, I think what's really important for us is, as Sarah outlined, we've got some very robust safety mechanisms here in the university, and I think what is really important is that regardless if a person has symptoms, is that we're able to quickly contain the spread of the virus. So that we would require those folks to be sort of in isolation. Sarah, would you add some additional?
So basically, right, they have to test and log their symptoms, but if you're fully vaccinated, it is not currently required that you isolate. And so that's the difference there. Of course, if the public health order changes, we'd have to change as well.
Great. Let's see. Shana, back to you here. Here's a question on the experience of the quarantine and isolation. Again, this would be just for unvaccinated students and a small portion of our total students. Can you talk a bit about the quarantine isolation experience? What will it be like? They go on to say our other son, who attended a different university, had a hellish experience at their university last year. So I personally don't want to see a hellish experience for any of our students. So let's address that one.
I don't either. I want them to have a positive experience, whether they are in quarantine or isolation. Students who are unvaccinated and who are have positive results and are isolated, we have an apartment complex on campus that we will house them in. We've worked really closely with our partners in Sodexo to make sure that we have meal delivery for those students. And ultimately, it depends on if a student's vaccinated and they're quarantined in their space. We also will have meal delivery, to their building to make it as easy as possible and to support students in that process. Sarah, I don't know if there's anything else that you would like to add to that. We may have some students that are quarantining that we will place in a hotel if they have been in close contact with someone who is positive. And we will also make sure that we have food delivery to those students as well.
Yeah, so the only other thing I would add is that one of the members of the COVID response team is a licensed clinical psychologist, and she has a team of graduate student psychology trainees who check in with students regularly. They have a animal assisted therapy program. So we have a puppy that can visit students, and we do other types of check-ins and outreach. And then anyone who is positive is also getting check-ins from the medical team at the Health and Counseling Center. We've had different, around holidays, gift bags, things delivered. So we really do try to provide whole person support, psychological support, wellness support, and physical health support.
And Sarah, if I might just add to that too, we have any number of ways that particularly our student clubs and organizations after this past year have learned in order to maintain connection with members who live off campus, who may have been farther away or had a need not to be in person. We have provided a number of opportunities for students to engage remotely using technology. So that's another way that we keep connections across the co-curricular or student spaces that I would anticipate would only grow this year as well. So I expect that students will be able to maintain some of the other connections that they have, even while they may be in isolation or quarantine.
And Shana, one last question while I got you. Are entire floors dedicated to vaccinated students, or how are we arranging the floors for our
So we
students?
work closely with Sarah and her team. It's based on your room, not by the floor. So there are students who quite likely might be in one room, they're unvaccinated, and the room next door, they are vaccinated. So that the only parameter that we had is that students had to have like vaccination status by room. So there are students that will be throughout the building at various levels and statuses.
Thank you. All right, for a change of pace, I'm going to turn to Dr. Jay Finnegan. This is a question about booster shots, which recently have been in the media and announced as a strategy to keep the virus at bay. The question is, do we have plans yet for booster shots that might be scheduled to be implemented as early as September?
Thanks, Jeremy. So booster shots are now a thing. They're starting with people who are immunosuppressed, and then we all anticipate they're going to spread to basically everybody soon. So first off, pairing with National Jewish and DU, we provided a lot of vaccines on campus last year. Thousands and thousands of people, Sarah could give the exact number, were vaccinated on the DU campus over a period of months, both DU faculty and staff as well as non-DU community members. And anybody who at DU who needs a vaccine today can come to National Jewish at any time and get one. And so that can happen at any time. We are continuing to work with DU to provide vaccines for both the unvaccinated as well as the right way to give booster shots to people at DU. That will happen, and we just need to figure out the right way to employ that. But anybody on DU's campus who needs a vaccine can come to National Jewish. I think we actually already have some coming this week or next week, and we do have some planned vaccination events upcoming in the next few weeks.
Wonderful. Thank you, Jay. And thanks to NJH for being a part of this webinar for our parents and students here. This one is back to Sarah. It's more questions on testing. And in particular, how move-in day will work with regards to testing. So the question is, my son is an incoming first-year student. We have looked at the portal and emails on COVID testing for move-in day. Is it correct that he would be tested at one of the on-campus sites and that he can show up for the test? Or is there a way to make an appointment from the portal? Lastly, does he only require one test? Just talk a little bit broadly about testing on move-in day.
Yes, and I appreciate that this has been complicated. So we are requiring that students test on campus. This is a change and it is necessary during the intensive move-in period simply because of the sheer number of people that need to be tested in that time and the fact that external records can really be quite difficult to process and decipher. So they don't have all the information we need. We sometimes have to call the clinic, that kind of thing. We can't accommodate when we're bringing that many people in at the same time. So please do test on campus. If you're moving in on the 6th, for example, ideally test on the 4th or the 5th on campus at 3 designated locations. You will be told which location goes with your residence hall. That's the closest one to your residence hall, and we ask that you go to that location. The testing locations will be open from 8 to 4. We are having a request in the chat, and I have just confirmed we can keep it open on the 5th until 5:30. Later than that will mean they're not resulted for Monday, so we don't want to open it later than that, but we will hold it open until 5:30 to accommodate the folks on the call who have asked about that, so we'll adjust that time. Then what happens is you wait for that result. A PCR can only run so fast. You know, we are really fast and we do it on campus, but they can literally only result so fast. So it takes 5 hours, you know, sort of functionally to run the test. We generally have them back in about 8 hours, and we result almost all of the tests from that day, that same night, unless there's a problem with the sample or some type of issue that comes up. The nasal swab test, which we'll also be offering, are resulted within 24 hours. So if you are testing day of move-in, I strongly recommend you go for the saliva option so that you get cleared that evening and not have to wait until the next day. And then it's, as the Chancellor described, it's a very straightforward process. You can do it as part of our research project or not. You can simply just consent to the medical step, do the testing, and we get the result to you. We do ask that you not eat or drink in the 30 minutes prior to doing your swab. So if you can just plan ahead on that piece. And then you can go ahead and move your stuff into your room and either stay in your room or go off campus until your test results, which will be available in your My Health portal, and you'll get an email to let you know it's ready.
Great, thank you. I think that really helped answer many people's questions around the testing for moving day, especially. Turning to Mary, the question is really about large lectures, Mary. All this sounds great, but why aren't large lectures being socially distanced? The vax is not holding up with Delta in so many instances. Is there any way of doing this in the classes with large numbers? Divide classes into groups they are in or not in the lecture hall. Talk to us a little bit about the environment of the lecture halls, the larger classes that we have.
Sure, glad to do so. We are not currently socially distancing the large lecture halls because we have confidence in the other mitigation efforts that we're taking. So we've shared with you the vaccination rate of those who are cleared for campus. That is well into the 90s. We've shared with you about the mask mandates that we're following. Any group of 5 or more that are indoors together need to be masked. So that obviously applies to the large lecture classes. And then Sarah shared earlier about all of the cleaning and disinfection regimens that we are pursuing together with the regular testing. Like the Chancellor, I just had my regular test this morning. So we have a high degree of confidence through all the mitigation strategies that we're pursuing. Naturally, should circumstances change, we will then change accordingly. We will be responsive to the scientific evidence. So want to provide you with that level of assurance as well. Thank you.
Thank you, Mary. Let's a couple of questions on masks. So this is back to Sarah and maybe Todd too. So one of the questions is, in what situations are vaccinated students required to wear a mask? And for that matter, when are masks required for anyone? And then more broadly, how do you ensure that unvaccinated students follow the protocols of masking? This is a problem throughout the country. And do we have any thoughts on the matter? So Sarah, why don't you lead off? And Todd, if you want to add any other ideas on how really improve their masks.
Sure. So following CDC guidance at this time, in most group settings, we have everyone wearing a mask. Right now, if you look at our dashboard, conditions on campus are really, really great. And we are testing people a lot. So it is not an unknown whether conditions are great. So at this time, in a group of 5 or more, you have to be wearing a mask. In 4 or fewer or outdoors, you do not. So that applies to everyone. If you are not fully vaccinated, you also have to wear a mask, except when you're alone in your individual room, in an individual study room, or while actively eating or drinking. That is an honor system. So people are not wearing a sticker or something that says whether they're vaccinated or not. If we do receive a concern, we follow up with that. If it is an employee, we follow up with that through the normal HR process. And if it is a student, through student rights and responsibilities.
Great, thank you. Todd, do you want to anything just to move the needle forward on masking?
Sure, and Sarah really covered it. It is both in classroom and out of the classroom. So when we talk about groups of 5 or more, that's in every situation. So that includes in our residence halls, that includes in a club or organization meeting or a program that you might be attending. So it could be academic, it could be extracurricular. So our students have been socialized to this last year. They did an incredible job. I really cannot say enough. I think Dr. Karis mentioned that at the opening, and we were so appreciative. And so that sort of peer adherence and peer accountability is something that we've seen, and we only expect will continue this year. We had very few problems in the way of adherence and holding each other accountable. And really what we found is students did that with the students themselves by asking the question, to reminding people, hey, make sure you bring your face covering. Hey, we got to do it because we have this many people. So we'll be re-socializing that, but I think our community is well already immersed in doing it. and we're very appreciative.
We are indeed. Thank you, Todd. Next question is for Shana again. It's a question about residential halls, and the question is as follows: my student has been vaccinated. His roommate is refusing so far. My student is concerned that he will be removed from the room and not with the other student. He's more concerned with making sure he doesn't lose his room and dorm that he specifically chose. Is there specific protocol on this, or is this case by case? Are there specific dorms or floors that unvaccinated students are being sent to? And the answer, we have covered that before, but I think this is an interesting case here. Shana?
My team did respond in the chat function as well. We are managing case by case. As you know, we're pretty fully occupied. And so we do ask that folks reach out to us if they're concerned by any room change. We will submit to students through email, through their DU email, any room changes that we make and the reason why we're making them. And so I could say it's likely that the student who's not vaccinated will be moved. There's not a particular residence hall or dorm that we would reassign the student to. It depends on availability and the status of the other students in the space.
Great, thank you. I will say there are fantastic questions that you all are asking us, so I really am appreciative of them. Here's one for the Provost, Mary. Is the study abroad program open this year? Also, what are the protocols if students test positive for COVID during study abroad?
Very good question. So yes, our study abroad is open for business, if you will. We are sending somewhere in the order of 400 students abroad this year, principally in the fall quarter, but really distributed across the year. We are currently requiring all students who are going abroad to be vaccinated. And we are providing access to those vaccinations, again, through Sarah Guatemara's auspices and those of NJH. I understand our study abroad students will be provided for in terms of vaccines. For a student who tests positive overseas, I will defer to Sarah, because I believe she has been working with study abroad on protocols for those particular circumstances.
For study abroad, and can you repeat exactly that part of the question?
It's for a student who tests positive while studying abroad, and what are our protocols?
I see. So that probably depends a little bit on the type of study abroad program and what exactly the public health requirements are in that space. So they'd be required to follow those specific requirements. And we have both study abroad programs that are affiliated with the university and those that are where the credits are accepted, but they're a little less of a tight relationship. So I think it probably varies. In general, though, testing positive, there's general agreement. Dr. Finnegan, correct me if I'm wrong, general agreement that isolation following a positive test is a strategy that is appropriate anywhere in the world. Is that correct?
Yeah, I mean, anybody who would test positive would have to isolate or quarantine, and some of this would depend on where you are, what country you're in, that sort of thing, because they might have their own local rules that a given individual would have to abide by while they're there. So that's true.
Okay. So for those that are actually in study abroad, and if they test positive, there's general advice, but it's also case by case, I think, is the best way to answer that question. So thank you for that. A good question for coming from parents on move-in day. Do parents need to get a pass and take a COVID test to access campus during the move-in days? So Shana, Sarah, you want to tackle that one?
So no, we're not requiring testing of parents. So you're coming for a limited time, you're wearing a mask, of course. We ask everyone to not come on campus if you have any symptoms whatsoever. So that's the way that we're handling that.
Yes, and we are asking that parents, we gave pretty detailed information to students that we're asking that they could stay in a 2-hour time frame, just so that we can manage the amount of folks that are on campus and that everyone wears masks when they arrive.
Very good. There's some questions coming in from graduate students, which we are so delighted to have on our campus too. This one's from a PhD student, and they ask, are there restrictions for bringing children and infants to campus? For example, going to the library, the bookstore, etc. Sarah, maybe that's a good one for you.
So that's something that depends on the alert level. So right now in alert level, green, blue, it is okay to bring children to campus. I had my children on campus yesterday. And you can just follow the general guidance, which is, of course, if they're under 12, they're not vaccinated. And so they need to be wearing a face covering at all times. And then that's, of course, for their own protection. If we have to move to a more restrictive alert level, we would provide updated guidance regarding children.
And kind of a related question is regarding badging, and you know, for some, this is a student employment and kind of challenge or issue. Can you obtain your student ID before you obtain badge access? Or do you need badge access before you come and pick up your student ID? Good question. Sarah?
So you should have your DUID number in multiple communications you've received from the university. It's something you need to log in, you need it for registration. So once you have that number, you can go ahead and get your test. So you can test at any of the testing locations just with the number without your ID. Depending on how you're coming to campus for the first time, your ID may be provided to you. So Shana, maybe you can talk about that process for students who are in. Graduate students, others, you can go and get your ID from the ID office. So there's a couple different, you're given them in a group setting, and sometimes you go and pick them up on your own, but you can start your testing just with your number.
In all of our communications, we provided students with their DU student ID number, and when students arrive for check-in, they will receive their, for new students, they will receive their ID card.
Wonderful, thank you. Question from Michael. There is a general interest in the difference between isolating and quarantining. Can you help the audience understand the two different concepts?
Yeah, it's so confusing, and it's a great question. One is referring to folks who have tested positive. Those are folks that we know who have the virus. And the other is for folks who have been exposed, they've had direct contact or exposed in that way. Of course, it's complicated. What further complicates it is has the person who's been exposed, the quarantine, have they been vaccinated or not? But it's really referring to, is it a person who is positive with the virus, or is it a person who has been exposed to a person? So those are the key differences.
Thank you. And speaking of contact tracing, this question came in, so maybe a good one for Sarah. What is the contact tracing protocol this year? At the end of last year, it did not seem to be required for building access. Any changes?
Yes, so last year we used both manual contact tracing and digital contact tracing. So we required everyone to download the Everbridge app last year, and we used that digital contact tracing tool. We are not using that digital contact tracing tool this year because functionally the manual contact tracing was actually much more effective last year, and is the primary tool that we used. So the digital contact tracing is really quite sensitive. And when we are fully densified, it will incorrectly capture lots of contacts that are not accurate. So it goes, because it's Bluetooth, it can go through a wall, for example. I am a floor separated from the Chancellor, and we have been a close contact through the floor. So it is just a little bit too sensitive. And so we're using what worked great for us, which is our manual contact tracing procedure.
Thanks, Sarah. And Sarah, while I have you, a question about the Ritchie Center, the athletic center, the gym. Is that open to surrounding DU community members, or is it only open to students in an effort to mitigate the spread of COVID?
That's an excellent question, Chancellor, and I actually don't know that answer. I wonder if someone else on the call knows whether we restricted it last year, but I'm not certain where we landed for this year.
Well, we'll find out an answer to that, and hopefully before the end of the webinar, and otherwise we'll post it to our websites under the frequently asked questions. Let's see. This just in, some more questions coming in. Will athletes that train outside need to wear a mask while working out? I think I know the answer is that masks are not required on the outside. So it is a very nice outcome this year that our student athletes are not training with masks, especially on the outside. They very much enjoy that. Will students be able to take food in containers out of the dining hall to eat separately, or is only indoor eating planned? Todd Adams, maybe a question for you.
Yes, we will provide to-go containers, compostable to-go containers for students to eat and run, if you will, or run and then eat in any variety of locations, whether that's back at a residence, on their way to class, or sitting outside. And we have a number of seating areas, even adjacent to some of our residence halls and certainly the community commons, that will allow students to eat indoors or outdoors. So that will be allowed.
Terrific. Thank you so much. And then a final question, I think, and then we'll wrap up for the hour. Will the immunity-based grouping continue with booster shots? So Jay, I think this question is, will booster shots only be available for maybe it's in, I'm not quite sure exactly what the question is. So let me read it exactly. Will immunity-based grouping continue with booster shots? I think that might be the case of whether or not the booster shot will be available more broadly across the population. I think you addressed that earlier, but if you don't mind.
So so that may be a question of, are you fully vaccinated until you've had a booster? And how does that classify into whether or not? And so I would defer to Sarah or somebody about how that is. My guess, as of today, what I would say is the definition of fully vaccinated is for the mRNA vaccines is 2 shots, 2 weeks after those. And I think right now DU is still working on that as the definition of fully vaccinated. Most of us anticipate that people who have already gotten 2 shots and are offered a booster will likely get one. We would have to discuss the situation of somebody who did not want to get a booster shot. To be completely honest, the evidence suggests that these vaccines are still very effective at preventing severe disease, and frankly, still very effective at preventing infection. And so even without a booster, people are still very protected just with the 2 shots of the mRNA vaccine, as well as with the Johnson & Johnson. Sarah, I don't know if you have anything else you want to add to that, or anybody else.
No, I think that's exactly right. And we'll adapt as we've done along the way. So if it makes sense to do a big event, we'll work together on that. And otherwise, there's obviously, they're moving generally for boosters towards having people vaccinated at pharmacies and medical offices. But we have our great partnership together, Jay, so I know we'll solve it.
Well, I personally have one more question for Jay and Sarah. So over the last week, I've had conversations with other presidents at universities. And what has surprised me in a couple of cases, just maybe 2, that they've started to talk about modeling where they see the peak of the Delta variant. Have either of you seen any modeling or any other kind of evidence to indicate that the life of the Delta variant may change over the course of the next several months?
So I think that question has to do with, will we essentially see the Delta variant burn out and start to go down? And the answer is probably. There is some evidence that in some areas we're starting to see some peak that is probably a combination of infection as well as increased vaccination. So you've seen increased vaccination in areas that have had a lot of infection. I will say that there are people out there who feel like over time, people will either get infected with the Delta variant or vaccinated, and that there will be very few, if any, people who don't fall into one of those two categories. I think I do think that's likely. I don't think we've seen it yet, certainly nationally, but it's something that I think people would anticipate. I will say that, the concern that many people on this call, on the DU community have heard us say before is it really is a race to the next variant, quite honestly. And so the part of the reason to try to minimize infection is to minimize the possibility of another variant happening. So Sarah or anybody else, I don't know if anybody else has any other comments.
Yeah, I think the forecasting, so there's a forecasting tool on the CDC website, and if you alter the data, you enter slightly, you get quite different results. So I think we're all still watching to see how that comes. But we have been for over a month only seeing Delta cases on campus. So and primarily in Denver. So we feel comfortable managing Delta, and the way that Lambda looks is really quite similar. So when people ask, I feel confident that we can manage Delta and Lambda, and then we will all adjust to whatever is next.
Thank you. I knew that question was a bit of a curveball for you two, but you handled it incredibly ably, as we have come to expect from both of you. And to all of our panelists, I want to thank you for joining us today. As you can see, the audience, students and parents have very interesting questions to ask of us. They are engaged, and we are thankful that they are engaged. We're thankful that you all joined us today and asked really wonderful questions. I am reiterating the fact that all of us share great excitement for the return of the students, your students, to the University of Denver. Their health and safety is paramount to us. That's the #1 priority for us. Their educational experience, of course, is right up there as well. And that's why we're so excited to have in-person classes in a robust way. We're confident in our strategies on how to mitigate the COVID-19 through testing, masking, and of course, vaccinations. And as we learn more, we keep communicating to you on a regular basis through the website and through emails as well. Thank you again for joining us today. Have a great rest of the day, and we look forward to seeing you all on campus. Bye-bye, everybody.